Hi, I'm Dr. Jeff Kieliszewski. Thanks for tuning into my weekly video blog on forensic psychology. Today I want to focus on a topic that's been in the news lately, and I would like to give you a forensic psychologist perspective on mass shootings and gun violence. First of all, let's define the issue and make a decision on whether or not there's actually a problem that exists. Well, if you look at the latest statistics, in 2018 there were well over 100,000 people in our country that were injured or killed by guns. And approximately 40,000 of those people died from guns. So do we have a problem in our country with gun violence? Well, I think a lot of people would argue that we do. So now that we've made the decision that there is actually a problem that exists, let's really define what gun violence is. So for the purposes of our discussion today, we're going to define gun violence as injury or death that results from malevolent use of a firearm. Now, a caveat. Mass shootings get the headlines and the political response. But mass shootings, defined by a gunman shooting 4 or more people, are actually account for less than 2% of deaths from overall gun violence. So you can argue that mass shootings are a problem, but for our discussion, I want to focus on the bigger aspect of this problem, which is simply gun violence, as I defined before. Now, there are all kinds of theories and myths that come out in the popular media or are proposed by politicians when there is a mass shooting or there's notable gun violence that's covered by the media. A few of the common myths are that gun violence is because of mental illness. Now, there are certainly some anecdotal or case-based evidence that there are people who have mental health problems that have engaged in gun violence. But what do we do as a society? Do we lock up everyone with mental illness? Do we try to make laws that prevent people with mental illness from having guns? Do we put more money into mental health treatment and prevention efforts? If you also look at the evidence, most people who have mental illness are not violent. A second theory or myth that's often put forth is violent video games causing gun violence. It's an old theory. It's been around for quite a while. Now, certainly there's some anecdotal evidence that violent video games can sort of stoke a person's fantasy of committing a heinous act. So what do we do as a society? Do we ban all violent video games? But also, if you look at most people who play violent video games do not commit violent acts. The third kind of popular myth or theory that you see is that we have easy access to guns. Well, I know when I do an assessment of risk for violence, one thing that I look at is access to the means to commit violence. We have a lot of guns, so as a society, do we ban all guns? Do we make it harder for people to get guns? So there oftentimes are a lot of theories that people put forth, and a lot of these theories may have some anecdotal or case-based evidence, right? A lot of times these theories or ideas policymakers run with, and they argue that they have a simple solution for what is actually a very complicated problem. So for example, these 3 theories that I highlighted, there are other theories too, right? There are theories that exposure to violent videos on YouTube cause violence. There are theories that we need to have more guns to prevent violence. All of these theories that are put forth, are these really actually possibly just factors involved in understanding gun violence? Maybe some are, maybe some are not. Now, I want to emphasize that gun violence is actually a very complicated problem. It's complicated in trying to analyze behaviors and situations that are involved that possibly lead one into gun violence. Now, the issue of gun violence is further complicated, in my opinion, because it's not only just a societal problem anymore, but it's really turning into a political issue. Now, history. Back in the early 1960s, we noticed we had a growing problem in our country with people dying in car accidents. So in 1966, Dr. William Haddon, who was a public health physician, was the director of the National Highway Safety Board. He decided we should look at traffic fatalities as a public health problem and utilize public health research methods and epidemiology in order to understand the problem. By the way, they defined in that beginning research approach, the automobile was defined as the, quote, agent of injury. That was kind of cool. So as a result, out of the decision to study traffic fatalities as a public health problem, there were a myriad of policies and regulations and laws that were eventually enacted based on the research that dramatically decreased the number of automobile accident deaths. And into the early 1990s, the National Center for Injury Prevention emerged and continued to take that approach in studying traffic fatalities as a public health problem. And they really got involved in enacting drunk driving law enforcement and things like that. Again, with the result of lowering deaths. So the big question, could we define gun violence as a public health problem? Just the sheer number of injuries and deaths would suggest maybe we could. Now, if we define gun violence as a public health problem, can we get government agencies to conduct research or fund research to try to understand gun violence and in order to develop a more science-based approach and how to lower gun violence? Well, there have been efforts to get our public policy approach science-informed, and there have been efforts to try to define and study gun violence as a public health problem. Unfortunately, many times those efforts have been interfered with, squashed, or thrown out by interest groups or certain politicians. Most notably in 1996, there was an amendment to a spending bill, and it was called the Dickey Amendment. And the Dickey Amendment's fascinating because what it did was it told the Centers for Disease Control, you can still research or fund research on gun violence, but your findings could not, quote, advocate or promote gun control, end quote. And then the Congress lowered the CDC budget by the exact dollar amount that the CDC had spent on gun violence research the year before. So I think the message is probably pretty clear. So in my opinion, if we continue to fail to approach gun violence as a societal problem and a public health problem, I think what we're going to see is we're going to see this continuance of everyone being in their corners and sometimes very well-funded corners, and that there'll be a patchwork of public policies and laws that try to address a very complicated problem. And a lot of times these policies and laws, in my opinion, are more reactionary, and they're definitely not based in the science. The other part it leaves us with is that if we do implement certain laws or public policies in regard to this problem, do we even have an actual way to study the outcomes to see if it was effective? Are there resources available to see? Well, those resources will not be available from a lot of government funding sources because that money has an attachment, and the attachment is you really can't talk about certain aspects of your findings as defined in the Dickey Amendment. Thanks for tuning in. I look forward to any comments you have and any discussion that you want to start. I will be doing my video blog every Tuesday in forensic psychology. If you have a topic or an opinion or a topic that you would want me to address in one of these, please email me. My email address is on the YouTube page. Also, if this is something you're interested in, please subscribe to the page and please pass this link along to others. Thanks.